Hi everyone, my name is Aaisha and today I'm going to be talking about hypermobile Ehlers-Danlos syndrome. So before I start, has anybody heard of this?
No.
Nope.
Heard of, yeah.
Okay, what do you know about it?
So it's when your joints might be a bit more mobile than usual.
Anybody else? No? Okay, can anyone try doing this?
I can do it.
No? Yeah, okay. So hypermobile Ehlers-Danlos syndrome is a group of inherited connective tissue disorders. So hypermobile Ehlers-Danlos syndrome is type 13 of it, so there's 13 types, and this is the last one. And it's the most common Ehlers-Danlos syndrome type. So about 1 in 50,000, the numbers vary because there's not much research done. Some people say it's 1 in 5,000 people, 1 in 50,000 people. So there's not much research done about it, so we can't really say how many exactly, like what's the occurrence. So basically, if we break inherited connective tissue disorder down, so we all know what tissue is. So the tissue that connects your entire body up, so stuff like your ligaments are a lot weaker than in a normal person, which can cause extreme flexibility, so people can do things like that. Their thumb can go all the way back. They can, do really crazy stuff like that. But unfortunately, it also causes things like joint instability, because obviously your ligaments are a lot weaker, which means that your bones and your muscles have to do a lot more work to make up for that. And there's also chronic pain. So that is because, for example, for a normal person, if you took an X amount, if it was like an X amount of, like a certain amount of energy that it took for you to walk like 10 steps, it would take a person with hypermobility like double or triple that much energy. So it causes them a lot of fatigue, a lot of pain, like muscle pain, or they hyperextend, or they like overstrain their muscles and bones and just their body in general. And there's also frequent bruising, so your skin is a lot weaker or like a lot softer, so there's more scarring, or people just have stretch marks for no reason. There's also bruising and obviously frequent injuries. So people with this condition are mostly recommended to not do any physical activity to reduce the risk for injuries. So the way to diagnose it, like I said, there's not much research done in it, so there's no like, oh, I go get myself like a blood test or a scan or something like that. They look at symptoms, so there's something called the Beighton score, the Beighton scale, and you have this, it's from 0 to 9, so 0 is basically you have no hypermobility, and 9 is extreme. So you get so it's basically every flexible thing that you can do on here, you get 1 point. So if your pinky goes more than 90 degrees, that is 1 point. So if you can do it with both pinkies, that's 2 points. You guys can try it if you want. So this would be 90 degrees, this would be beyond 90 degrees.
Oh my god!
And then the next one is your thumbs. So your thumb should be able to touch your wrist.
Oh my god!
For both sides. So that would be 4 points. And then there's your elbows. You can't really see mine, but they have to hyperextend over 180 degrees for both elbows. Yeah. You can't really tell. And then there's your knees, which you definitely cannot see. That also hyperextend beyond 180 degrees. And there's your spine, which you have to bend down completely, which I'm not doing now. So that is your Beighton scale. So for example, say you could do like maybe 1 pinky, 1 elbow, 1 thumb, and your spine, then you're a 4. Or if you can do everything, then you're a 9. Then you have like extreme hypermobility. Some people have it like in a specific area, like for example, just their elbows or just their legs. But most people will have it throughout their body. So how is it managed? There are no treatments right now, unfortunately. Like, as I said, there is not much research done. So the main thing you would do is manage the symptoms. So a lot of the time that can be done at home. So stuff like just restrict, like controlling the amount of physical activity you do. So everyone's symptoms are different. So you need to learn your body, like if you have this condition, you need to learn what you can do and what you can't and what your limits are. For example, for some people, they can only, like if you have this condition and you like working out or you do a sport, for some people they might like do it for 2 weeks and then they give like a 2-week break, and that's how they let their body like heal and rest, and then they start working out or doing that exercise again, or that sport. Some people use like heat, ice for injuries, because if you ask a person with hypermobility, they most likely always have some sort of injury on them, whether it's like a sprain or something broken or just like bruising and stuff like that. And another thing you could do is managing sleep. So sleep does become difficult because a lot of people with this condition almost every day wake up with some sort of subluxation, which is like a partial dislocation. So you'd wake up with like your shoulder like out somewhere. And sometimes because you are more flexible, you can like sleep on your like arm or your leg or something, and that causes a lot of pain. So most people will wake up with like extreme amounts of pain. So the way people manage that is obviously like some people have I don't know if you guys have seen like a pregnancy pillow. So it's like a U shape, and they sleep within that to restrict their movement or just things like that. And so recent studies have also shown that hypermobile Ehlers-Danlos syndrome also affects the brain. So I think it was Brighton and Sussex Medical School which did a research on hypermobility and the amygdala. So the amygdala is a part of your brain which is responsible for your like fight and flight response, and basically like for your anxiety and stuff. So people with this condition have large or enlarged amygdalas, and the reason for this, they say, it might be because of pain sensitivity, because obviously they experience more pain than a normal person. But this also means that people with this condition have a lot more anxiety issues, which also leads to another symptom which I forgot to talk about, which is excessive sweating. And yeah, that's pretty much it. There's a lot more research on the brain, such as they've got, I think, a smaller certain cortexes of their brain, which reduces their spatial awareness, which means that they like when you're walking, you bump into things like a lot more like quicker, or you just like you would be walking, you walk into a wall, or you bump into someone and so on. And I'm really talking about that about this person, which is Hayley. So this is a true story. She was born with like bent legs, like hyperextended legs. They call it like bowed legs, and she also had overcooked skin. And yeah, and when she was born, she started having a lot of like digestive issues. So everything that she ate just went through her, and so her parents obviously sought a lot of professional help, and they like changing her diet around. They found out what worked best, so they removed like gluten and wheat and so on. And in a couple months later, she was fine. But then as she started walking, her parents realized that she was bumping into a lot of things. She had frequent scarring and bruising on her legs, and her walking just wasn't normal. So they went to the doctors and they said that she has weak legs. They just dismissed it as, yeah, she's not growing properly, so she has weak legs. And they told her to join some sort of sport like ice skating or gymnastics. So she joined gymnastics, and by the time she was 8, she absolutely loved it. And at the age of 8, she started performing nationally. And but something she realized was that she had a lot of injuries. So she'd come home like almost every single session of gymnastics with some sort of injury. So she'd dislocate her shoulder, she'd sprain her knee, she'd break something, she'd bruise something. And it started becoming a big problem because that obviously affected her gymnastics. And by the time she was 14, which was the last time she performed, she actually had three fractures in her spine. and she had to be in a brace for about 6 months, and followed by 5 months of physiotherapy. So she obviously, like, by the time she was in secondary school, she realised something was wrong with her, like she was different to a lot of people, but no doctor could help her. They just dismissed it as, oh, you're weak, or what's the word? I can't think of the word. They helped her symptoms, but they didn't tell her what's wrong with her. So she started struggling, and by the time she was like in 6th form, she already knew how to like tape her ankle. She knew how to treat herself basically for all her injuries, and she decided to be a physiotherapist because she basically knew everything. And when she was doing physiotherapy, she was learning about this condition. She realized that a lot of the symptoms were similar to hers, and she recognized that this is what I have, that I am hypermobile. I have hypermobile Ehlers-Danlos syndrome. But when she told her professor, they just dismissed it, saying, oh, but you don't have all the symptoms, because there are like loads of symptoms, and she didn't have all of them. She had most of them. But as she grew up, like about when she was about, I think, 24, that's when she went to a rheumatologist and got it diagnosed. But unfortunately, because of that, she spent almost half her life not knowing what was wrong with her, which had a massive impact on her mentally. And that is the problem with a lot of people who have this condition, unfortunately, because there's not much research done. So like a lot of people go undiagnosed, which means that they struggle literally for their entire life. And one of this, so this is a quote: sometimes when you hear hoofbeats, it really is a zebra. So it's something that a lot of health professionals are using now to diagnose Ehlers-Danlos syndrome, because basically what it means is like when you're diagnosing someone, don't always think about like the most common conditions. You have to look at like everything that it could possibly be. And yeah, that's it. Thank you for listening. Oh, any questions? Yeah.
I'm not sure if you could also answer it, but do you know why hypermobility? Do you know why it affects her digestive system?
So it is part of is one of the symptoms of one of the rarer symptoms of hypermobile Ehlers-Danlos syndrome, and the reason for that is obviously to do with the connective tissue and so on. But sometimes with hypermobile Ehlers-Danlos syndrome, or any any type of Ehlers-Danlos syndrome, they have more than one condition linked to it. So some people will have hypermobile Ehlers-Danlos syndrome, and they will also have like stuff like Marfan syndrome or some sort of digestive problem. It will usually be linked with some other problem. Yeah.
What number are you on the scale? Yeah.
9.
You have.
What? Any other questions? Yeah.
How do you cope with it?
To be honest, I've most of the things that I said about managing it. So I know like my limits of how much I can do in a day before I get like really tired and burn out. So I just kind of use that as a guideline of how much I should do in a day. Yeah.
Is this like genetic or environmental, or like is it not known?
They say it's inherited, so if one of your parents have it, or you almost likely have it.